right. Well, great to see you all, and we're really excited to tell you what we're up to at Trusty.care. My name is Joseph Schneier. I'm the CEO and co-founder of Trusty.care. And as most of us know, healthcare costs are our biggest financial risk area, especially during retirement. And at Trusty, we believe that the best way to address that challenge is to make sure that the 150 million Americans who purchase insurance without an employer get the best information on their options, no matter how they're purchasing. So every person on this call, if you're an American, but also internationally, will at some point purchase a supplementary health insurance product. And some examples of these are Medicare, dental vision, or Obamacare. And one of the core problems that we're finding right now is that most people purchase the wrong plan. And that could be anywhere from it makes you go bankrupt to you're overpaying on your medications. And the way that you purchase an insurance product in the US is it has to go through a broker. So if you become a direct-to-consumer digital platform, you are a brokerage, or if you're a call center, you're a brokerage, or you're a field broker, you're a brokerage. And Trusty.care has taken a different tactic than some of the other companies in the sector, and has said that we want to provide a toolkit for all of those channels to improve sales to the 150 million Americans that purchase this type of insurance product. This matters not only for the consumers in the Medicare Advantage space, in particular in digital sales, they're experiencing a 50% rapid disenrollment rate. And this is crazy for an industry. 50% of the time you sell a product and people are returning it. So that's not great. That affects consumers. The reasons that they're returning it is they realize quickly that this is not the right plan for them. And the reason this is happening is that consumers understand that as soon as they get the plan, they can't go to the providers they need to go to, their medications are not covered, and they're dealing with a lot of unexpected costs. It's an urgent issue for the carriers. It's costing them about $110 million per regional carrier, and there are about 900 of these regional carriers. So what is Trusty.care doing about this? We're getting consumers into the right individual health and medical insurance plan from the get-go, from the first time. And the way we do this is we've got a SaaS enterprise platform that we sell to payers and to distributors, and it improves how these products are distributed. First of all, we ask people the right questions. We automate taking in health claims and EMR data on the consumer so that they don't have to answer a whole bunch of questions. And then we analyze thousands of different plan options for that consumer. And we're breaking the sales status quo by working horizontally across the industry to solve the core infrastructure problem in health insurance sales. The quoting part is just a symptom. All of sales and distribution is broken. It leads to lots of costs in administrative costs. And we believe that automation without getting rid of jobs is possible in this sector. And that's what one of the other things that we're participating in doing. Our customers reach about 50 million Americans. You may not know most of these names, but they're big in the sector that we work in. In the last year, we've grown from 500,000 a year to 3.1 million and 37,000 brokers. And just last thing, we've got two asks. We're raising a 15 million Series A round right now in two tranches, 4 million convertible note. We've got 1.5 million of that available. And then in Q2, we'll be raising the second portion of that, a price round 11 million. Second key ask, we're looking for introductions to Blue Cross Blue Shields across the country. So we'd love introductions to any of those. And I am happy to field any questions.
Thanks, Joe. So just a question off the bat, why don't carriers do this themselves?
Carriers have never traditionally built a lot of their technology internally. Neither does Medicare. It's almost always built by external vendors. Lots of reasons. If you're a tech engineer, going to work for United Health Group is not really the top of your list. And so they have a really hard time attracting really great talent. So for the most part, it's outsourced and usually to a lot of different consulting firms. So we're looking at, can we provide the entire service to them rather than having this sort of Frankensteinian approach?
That makes sense. Question from Esther Dyson. How do you deal with the fact that people's past spending may not indicate ideal care, but only what they could manage with their previous imperfect plan?
So that's a good question. We're not focused on getting them on determining on the medical side what type of care they get. We're only focused on reduction of cost. We are able to see if they were prescribed a medication and didn't pick it up. And so that's one of the areas that we do spend time looking at, is how we can improve medication adherence. We also look at preventative care. We can see if they're not taking advantage of that, and encourage individuals to take advantage of preventative care. So those are 2 areas we've isolated so far. I'm sure we'll explore other areas as we continue to grow.
Thanks, Joe. There are 2 revenue-related questions. One is just asking for you to explain your revenue model, and the other to share what your revenues are.
Sure. Enterprise SaaS model, both to carriers and to distributors. The revenue is between $300,000 a year for a contract to $2 million a year for a contract. We ended 2020 at 500,000 ARR. We're now at 3.1 million ARR, and by February we'll be at 5 million. We have a backlog of customers that want to onboard to the system.
That's awesome. Congrats on that growth. And then last question that we have time for: who are your closest competitors?
You will likely not know their names. Our closest competitor is a company called Sunfire Matrix. They are a quoting and enrollment platform for Medicare. They don't do all the other lines of insurance that we do, like ACA and ancillary products. And then the second one is a company called Connecture that's been around for a very long time that people are not very happy with. So closest competitor is Sunfire. There's not a lot of people that want to play in this market. It's very difficult and highly regulated. So it's a pretty green field.